Hello and welcome to day two, of Product Earth Seminar Zone. Also the Lobster Pot podcast. I'm Dave. Nice to see everybody. Well, I can't see you, but there we go. But we have our next esteemed guest in the podcaster zone here. We have Elena Battaglia. Nice to meet you, Elena. How are you doing today?
Hi, everybody. I'm doing pretty well, thank you.
Excellent. And you're based just in Italy. You said you're sort of northern Italy, which I'm sure is a lovely part of the world. But you're a specialist in animal health care and talking about cannabis for pet health. Is that right?
Yeah, I'm a veterinarian, and I started studying and getting to know CBD and cannabinoids in 2016 because I had my 17-year-old dog, and she has, like old dogs, she had a bunch of problems. She was scared of thunderstorms, and she had arthritis. And she was a bit senile. So she had all these problems, and I could not find a solution for all of them. Like I have tried.
And you tried different things.
I tried different things. I tried, natural stuff, and then I tried not natural stuff. And they seemed to work maybe for a little bit.
Yeah.
And then she just fall back into her problem. So I got interested in CBD, and I was on vacation in the United States, and I found this CBD. I brought it back, and I said, what the hell, let's try it. And after just 4 days of using it, she completely changed. She was another dog. She started moving more, getting up, and we went. She died like almost a year after that. And she kept on taking CBD, and I didn't have to give her anything else. I mean, yeah, it was really a miracle on her. So that's when I said, wow, if it works so good for her, I mean, everybody should be able to use it, because why hide it? Because it can help lots of animals, especially older dogs. They have many problems, and CBD or cannabis, depending on what you use it for, they kind of tend to solve many problems altogether, just for the reason that, they act on the endocannabinoid system. So the endocannabinoid system is everywhere in your body. So that's the reason they can help out, like, more or less everywhere. Of course, it's not a miracle drug, but it does solve lots of problems.
No, exactly. It's not a cure, but I know, but it also alleviates a lot of symptoms, and both in humans and in animals as well. But yeah, tell us a little bit more about the sort of seminar and what you were going to talk about, because I know it's around this, but yeah, let's hear a little bit more.
Well, the important part is when I wanted everybody to know that, CBD is that when you choose it, it's better to have a veterinarian that tells you which one to use, because you have to, usually the best choice is a full spectrum. That means that it does have traces of THC, because they usually work better. If you're just using CBD, that's just a single cannabinoid, and it's not going to do the job as a full spectrum. Then, of course, if you do want to use cannabis, well, that's a whole different story, because you definitely need to have somebody that can get you started, because cannabis, when you start it, you have to be followed even more, because it does have a psychotropic effect. So you don't want your dog or your cat, to get high. As for CBD, when a CBD is chosen, you have to choose one that it's natural. You have to check that if they say it's like a 5%, it's actually 5%. So you need exams. They have to give you these exams that show that it's actually 5%. And then that it doesn't contain like heavy metals or pesticides and all that stuff. Otherwise, you're trying to give something to heal the dog or the cat, and then you're just making it worse because you're giving it, heavy metals. Okay, so that's the first step. Okay, and there are lots of let's say you could use it for lots of therapies that can go from osteoarthritis. And osteoarthritis, let's just say that CBD works like if you have a scale from 1 to 10, it can function. It can be okay for like 1 to 6. If pain goes over 6, usually you probably need THC. Okay, because if it's lots of pain, THC is the best choice. This doesn't mean that you're gonna give only THC. You're gonna have to use something that's like a CBD to THC 1-to-1. Okay, as much THC as CBD. When you're doing that, you might want to consider even other cannabinoids, because as for pain, CBG is very important. It pairs up with CBD really well, and it just makes it work better. So if you're using a full spectrum, it doesn't have that much CBG in it, you might want to add it before thinking about passing over to cannabis. Then another cannabinoid that works really well for pain is a CBDA. So you might want to consider maybe a full spectrum that has like 50% that's CBD, 50% CBDA, and maybe add a CBG before eventually going off to using cannabis. And the other therapies you might use it for, it could be like skin lesions, dermatitis, that stuff. Another problem that in which it can help out is gastrointestinal issues. Then all the epilepsy, neurological issues, CBD, CBDA, and CBG really work well for epileptic animals. And of course, all the oncology patients. But usually when I treat oncology patients, I team up with CBD, THC, and CBG, and the terpenes, because terpenes many times are fundamental. Even if you have like already an oil preparation that has the whole plant inside, so the whole cannabis plant, you might want to consider adding. In Italy, we have the ability, we can, because the pharmacy prepares the oil, we can add certain terpenes to the formulation. So we're able to add like limonene, which is anti-cancer, or linalool, that's anti-metastatic, or myrcene for pain. So I usually tend to do that for oncology patients.
Wow. Again, there's so many kind of elements to it. I guess if someone has, wants to kind of talk to their own vet around, the potential use of cannabis or CBD for their own pets, where should they kind of start? Obviously there's a lot of information online, or people like yourself who are experts in this sort of field. But I guess for people who have tried or exhausted different sort of treatments for their pet, what's the kind of first step they should kind of take?
Well, there's actually there's the Veterinary Cannabis Society in the United States. They have a list of veterinarians that all over the world. So they might even have, they might have a veterinarian in the UK that's listed, and so they could contact one of those. On the website of the Veterinary Cannabis Society, they also have like programs for pet owners, not only for veterinarians. So they could actually find some information there that they could share with their veterinarian. So they could, actually go to their vet and say, check this out. Can this be useful for my dog or my cat? So that could actually be an easy way to start.
No, absolutely. Very cool. I guess it's a case of do a lot of people, do you find, a kind of hesitant when kind of trying it, or what kind of, again, you talked about your own experience. I guess there are lots of kind of incidents like that, but is there kind of any research and things like that has been, proven to show that actually this has a really positive effect for, like you say, everything from pain management to kind of epilepsy? What sort of studies are out there that?
Well, there's plenty of them. There's plenty in, especially in human medicine, and there are some out in for animals, and they have them on the Veterinary Cannabis Society website. Actually, they have a lot of them, so they're divided depending on what you have to treat. And What I see usually is lots of pet owners know more than their vets, because they go on the internet, they search for an option, just like I did. I just went on the internet, looked for an option for my dog, and I was a real pet parent in that instance. And they usually come to their vet and they say, "Oh, I read this. What can I do?" Unfortunately, we do not have that many veterinarians that know a lot or even a little, and that's really bad, because when you have a vet that says, "I don't know anything about it," try this doctor or that doctor. Okay. And that's okay. But unfortunately, we also have lots of vets that say, "Oh no, it doesn't work. Oh no, it's complicated. Oh no, your dog's gonna get high. Oh no, you can't give THC to cats." And I've heard all of it. So
Mhm.
that doesn't work well for the treatment.
No, I guess again, it's very similar in terms of humans, in terms of doctors, in terms of there's still the stigma, there's still the lack of knowledge. It's not something that, well, I guess a lot of doctors or veterinarians themselves have as part of their kind of education, right?
Yeah, yeah, because I mean, we don't have the endocannabinoid system when we go to school. Nobody tells us about it. So you have to find out by yourself, or find a reasonable literature that to read, and to get you to catch up.
Yeah, no, absolutely. And again, I think that's the case. A lot of patients, a lot of human patients, will go to their doctor and go, what about this? And know a lot more than their GP would. And I guess, like you say, it's a similar principle for those who are interested in it for their own pets as well. So that's interesting.
Yeah. What I always say is to pet owners, don't stop. I mean, even if the first vet tells you, "Oh no, it's not good for your pet," or just find somebody else. Okay, find somebody that can actually you can actually see that they know about it. Okay, because most vets will just go, "Nah, it's not going to work." And the other thing I always hear, at least here, is like, "My veterinarian does not believe in cannabis," and I'm like, "It's not a religion, you know." it's
So I'm cannabis agnostic, but
yeah,
yeah,
it's not that you have to believe in it.
it's not. Yeah, it's not faith medicine, is it? No,
No.
absolutely not. It's proven, but it's just getting those stories. I mean, what's the kind of legality of it, particularly in Italy at the moment? Is it CBD? I mean, we hear sort of varying
Oh,
things.
it's crazy. It's crazy. It's like right now it's temporary legal because
Okay.
they tried to make it illegal. They tried to make it like THC, and that was stopped, and they're going to reconsider it in December. So it's like we go on from one stop to another practically. And now the newest thing that they're trying to do is totally block the hemp sector so that nobody can plant hemp anymore. So that would be crazy. That would just be third world country or something. And they're talking about that, and I don't see no reason for it. I mean, it's just it's crazy that they're so upset over a plant when there's full of people getting other drugs or alcohol or whatever.
Absolutely. Exactly. I think that's the same kind of the world over, but I know Italy seems to have a sort of fairly fragmented approach kind of more broadly when we start to see. But again, I guess the same rules about the substance or use of the substance or access to it apply for humans as much as pets, or and vice versa.
Yeah. Yeah, we're lucky that we don't have any problems with cannabis. I mean, a veterinarian can prescribe cannabis to animals without any problems, and that's the good part. But of course, not every animal needs cannabis. Most need CBD, so we can't just start them off with cannabis right off. So that might be the problem in the next year.
And what sort of instances would you actually prescribe THC laden cannabis, if you like, versus, so medical cannabis versus just CBD for pets? What kind of conditions?
Well, like if it's arthritis and it's really bad, like they have a pain on 1 to 10, like 8 on a scale from 1 to 10. Or, well, if it's an oncology patient, always. If it's an epilepsy patient and they've tried normal medicine, they've tried CBD, it's still not working, then I pass them over to cannabis. Some gastrointestinal issues, if it's really a very inflammatory issue, I would start off with cannabis. I never use it on dermatitis or skin lesions or skin diseases, because most of the time CBD and CBG do what has to be done. So I guess that covers it most everything. Yeah.
For sure. And I guess with kind of animals, I mean, obviously we talk about pets, we think dogs and cats, but what other animals have you seen it kind of successfully work with?
Well, I've treated rabbits. I've treated a chimpanzee from Spain, and that had orthopedic issue, and he got better with just CBD full spectrum. Then we've treated pigs, cows, and goats. Wow. And the cows and goats usually get better just with the CBD full spectrum. Pigs, I've usually used cannabis because sometimes they really have osteoarthritis problems and they can't stand up. So they usually get better with cannabis.
Wow.
But crazy. Of course, all the animals have an endocannabinoid system. So
yeah. Indeed. Cool. Any other kind of points from the seminar that you kind of wanted to raise, or?
Well, there's one really important one, because many people think that THC is just for pain. THC is not just for pain; it's also for severe inflammation, and it's very important when you have a cancer diagnosis. Lots of vets, people go to the vet here, the vet says, oh no, it's not cannabis time yet, you gotta wait for it to have pain. No, you have to start cannabis right away, because that's gonna slow down the cancer. Okay, we've seen it I've treated more than 4,000 patients since I've started, and ranging from, skin lesions to epilepsy to cancer. Cancer patients really do get better. They live longer, and they start, feeling better, having more appetite, even like in the first 15 days.
Oh.
So it really does change your life.
This is it. I mean, it's all about the kind of quality of life. And again, like you say, it's not necessarily a cure for everything, but it can mitigate a lot of symptoms, and and it's just again, it's hard for people to kind of understand. I think, again, when you talk about, human patients and, what does it do for you? Oh, you just have it to get high, don't you? Even though it's medical. And again, when it comes to animals, there's no intent for any recreational, usage. So again, the evidence, I guess, speaks for itself that, there's no kind of psychological kind of bias in that regard. It's actually, we can visibly see what's happened here.
Yeah.
Which is fascinating. It's fascinating. So where can people find out more about you and your work? Well,
I'm listed on the Veterinary Cannabis Society website. So my email should be there. And I think that's the easiest way. Otherwise, if they do type my name down on the internet, they should find everything too.
Excellent, cool. And you're kind of open for people who've got sort of questions, or are you curious to think more? Excellent. Sure. Very, very good, cool. Any other points? I mean, this has been really interesting, but anything else you'd like to sort of
I think we covered the big part. Yeah.
But no, fascinating. And again, I think it's more and more as people are thinking around their own kind of wellness routines, that obviously more and more applies to their own pets as well. And, staying healthy and having that kind of quality time is what counts. And again, I think increasingly people are more, in tune with what their pets need. And I think that's a very lovely thing to see. And I think, again, if cannabis can play a part in helping people and their pets have better, longer lives together, then that can only be a good thing, right?
Right.
Awesome. Well, thank you so much for joining me, and I look forward to speaking to you soon.